Radio Health Journal talks about the effects of air pollution after this.
Technology changed the way I listen to music.
Technology changed the way I plan travel.
Now, technology is changing the way people invest. Whether you're a multi-million-dollar investor or just starting out, Betterment is the smart answer to the question, how should I manage my money? Powered by smarter technology and personalized for your financial goals, Betterment automatically manages your investments and minimizes taxes, all for a fraction of the cost of traditional financial services. You just set it and forget it. With over 95,000 customers and $2.3 billion under management, Betterment is the smarter, easier way to invest. Isn't it time you use smarter technology to build your wealth? Sign up today and receive up to 6 months free. Get full terms and conditions at betterment.com/podcast. Betterment. Investing made better. Sign up for your free trial at betterment.com/podcast.
You probably know air pollution affects your health, but you may not realize just how big an impact it can have. The World Health Organization links air pollution to 1 in 8 deaths worldwide, including about 200,000 in the U.S. per year. Still, most of us take for granted the impact air pollution has on our lungs.
If you look at all the different kinds of lung diseases, all of them pretty much are associated with worsening based on levels of air pollution. And there might even be some causation as well with regards to the effects of air pollution on the lung.
That's Dr. Stephen Nathan, director of the Advanced Lung Disease and Lung Transplant Program at Inova Fairfax Hospital in Falls Church, Virginia.
You take a disease like chronic obstructive pulmonary disease, and if you're exposed to enough air pollution, thankfully not seen here in the U.S., more in third world countries, even in the absence of smoking, that can be enough to cause significant COPD. If you look at many other diseases from asthma to interstitial lung disease, the main one being idiopathic pulmonary fibrosis, all of these diseases appear to be impacted by air pollution.
Nathan says most people he comes across don't know that where their home is located can determine how healthy their lungs are.
There was actually an interesting study that I would mention out of Europe from a couple of years ago. What they did in this particular study is they mapped patients' addresses to major highways. And what they showed was that those patients who lived closest to the major highways had worse outcomes, greater incidence of chronic rejection, and more mortality associated with this. So whatever disease has been looked at previously has been found to be associated with worse outcomes with regards to exposure to air pollution.
It's true that air pollution can introduce us to chemicals that cause things like heart disease and liver toxicity. Still, Nathan says our lungs should be the primary concern when discussing air pollution because they're directly exposed to the environment. Every day we breathe countless potentially harmful air particles. Nathan came up with an acronym to make these particles easier to remember, CREP, C-R-E-P.
And what CREP stands for is circulating respiratory aerosolized particles. So there's a lot of crap in the air that we all breathe in that can affect our lungs and ultimately our health.
It's important for people with lung conditions to stay inside when air pollution warnings are in effect. Even indoors, though, Nathan says precautions need to be taken to ensure the air is safe.
Maintaining a clean house and a clean home and making sure that elevated levels of radon, for example, which can occur in some basements, but at least you have more control of what's happening in your own internal environment.
Nathan says that obviously even people with no documented lung conditions should protect themselves from air pollution too. This way they can try to prevent the onset of such diseases.
You're not protected if you have normal lungs. So I did mention only patients with various diseases because that's where it's more evident. But there have been studies that have looked at lung growth in children and compared those children growing up in areas that are more polluted versus areas that are less polluted. And the amount of lung growth you get in a more polluted area is less.
And it's not just a risk for children. Living in a polluted area is comparably dangerous for adults. Nathan says air pollution can have effects similar to those of smoking cigarettes.
What's been shown is if you live in a more polluted area, your loss of lung function after the age of around 25, 30 is greater than if you live in a less polluted area. So in a lot of ways, it does function like cigarette smoking.
Some of the most prevalent air pollutants are lead, carbon monoxide, sulfur dioxide, ozone, and mixtures of gases coming from car exhausts and electric utilities. These pollutants can lead to lung disease, lung cancer, and one disease Nathan is particularly concerned about: idiopathic pulmonary fibrosis.
Idiopathic pulmonary fibrosis, or IPF, as we'll talk about, is a form of chronic progressive scarring of the lungs. The idiopathic means we don't know what causes it. Pulmonary is lungs, and fibrosis is scarring. And it truly is an underappreciated condition. It tends to occur in the elderly folks, but can certainly occur in folks as young as 50 years old. Males tend to be more affected than females, and there is a link with smoking, not quite as strong as what we have with COPD, but about 70% of patients have been smokers or are current smokers.
Experts estimate there are somewhere between 100,000 and 200,000 cases of IPF in America at any one time. Nathan says many cases are misdiagnosed because the main symptom, a gradually increasing shortness of breath, is also a symptom of more common diseases like COPD. Even though IPF isn't as prevalent as various types of cancers, the disease is incredibly lethal.
The only cancers that have more total deaths in the U.S. than IPF are things like breast cancer and lung cancer. But if you take other more common cancers like prostate cancer, cervical cancer, uterine cancer, leukemias, there are more deaths from IPF than any one of those cancers.
Fortunately, developments to help those suffering from IPF have arrived. As recently as last year, the only real treatment for IPF was a lung transplant. But since only about 25% of patients are healthy enough to have a transplant, there was little doctors could do for most patients in spite of having a diagnosis. Now, however, doctors have more treatment options.
There are two drugs. The one is called nintedanib and the other one's called pirfenidone. They're both approved in the U.S. in mid-October of last year based on clinical studies that showed that they both worked to slow the deterioration in lung function. So what they do is they slow down the progression of disease in patients with IPF. Neither of these drugs are a cure. They don't reverse the disease. They don't restore lung function. Once the lung function is lost, it's lost forever, at least thus far. We don't have anything that can reverse the pulmonary fibrosis that does exist. But that's why it's also made it important to be aware of this condition, because the earlier the diagnosis is made, the earlier the patient is placed on one of these therapies, the more likely it is that you'll preserve the lung function for longer.
Just as important as treating the disease is preventing it in the first place. Experts say one of the best things you can do for your lung health is some good old-fashioned cardiovascular exercise. Maybe just try to go for that 3-mile run closer to parks and forests than factories and busy roads. Our writer this week is Evan Rook. Our production directors are Sean Waldron and Nick Hofstra. I'm Nancy Benson.
Geico applauds your inner road name.
A slow clap goes out to your biker alter ego. You might be mild-mannered Michael in the office, the guy known for raising his hand in meetings, but out on the open road, it's Motor Mike. Geico supports you and your bike, Motor Mike, because beyond cars, Geico insures motorcycles, those glorious vroom-vroom machines. With 24/7 customer service and great rates, the only thing you'll be raising from now on is a heck of a good time. So head out on the highway and make that road yours, Mike. Make it yours.
Geico Motorcycle. See how much you could save.